In 2024, about 6% of Americans took a GLP-1 agonist medication such as Mounjaro or Ozempic. That means tens of millions of adults in the United States take them. Are they a good idea for you or someone you know? That is what we're talking about in this video. GLP-1 agonist medications were invented in the early 1980s and were approved by the FDA in 2005. GLP-1 stands for glucagon-like peptide 1. Agonist means that this substance bonds to a part of the cell that leads to some kind of reaction. In short, a GLP-1 agonist basically serves to increase insulin, which reduces blood sugar levels, and it can help people feel more full so they eat less. When taking these medications, people are likely to choose healthier foods, exercise more, drink more water, spend less on food, snack less, and eat more fruits and vegetables. Basically, a GLP-1 medication can turn you into a more disciplined version of yourself. The majority of people who take these medications are either diabetic, obese, or diabetic and obese, which makes sense when you consider the impacts that the medication has on blood sugar and eating habits. With nutrition and exercise being the main focuses of my work over the past 2 decades, it's easy to say that is the route that you should go and everyone else should go when it comes to losing weight. Unfortunately, research does not support that approach for many people. The research on diet and exercise show that the combination of the two can generally lead a person to lose, on average, about 5 to 10% of a person's total body weight. If you weigh 200 pounds and you want to weigh 180, then diet and exercise are sufficient. However, if you are looking to lose a larger amount of weight, such as 50 or 100 pounds, diet and exercise are unlikely to get you there. A weight loss medication or bariatric surgery is likely a better option. GLP-1 agonists are shown to help people lose about 15 to 20% of their body weight. Bariatric surgery, which most often is where people are rerouting food so that it barely goes through their stomach and then continues on to their intestines, meaning that their stomach can hold only a small amount of food, is the most effective way to lose a large amount of weight. Bariatric surgery is shown to help people lose anywhere from 25 to 50% of their body weight. I'll discuss bariatric surgeries at another time. The main point is this: if you need to lose a large amount of weight, a GLP-1 is a more proven way to go. But before we get into my recommendations, there are a few other things to consider about taking one of these medications. Like most medications, there are side effects. The most common side effects are gastrointestinal issues, such as nausea, vomiting, or diarrhea. This impacts about 10 to 20% of people who take this medication. In fact, it is actually more common for the people who see results from taking a GLP-1 medication. Acute kidney issues and high blood pressure also occur often with GLP-1s, although these side effects are related to many users being diabetic. Pancreatitis is another commonly found drug reaction. Besides side effects, there is another consideration before you sign up for taking a GLP-1 medication. As noted, it can help you lose about 15 to 20% of your body weight. Unfortunately, anywhere from 20 to 50% of the weight loss is lean mass. This includes bones, water, and mostly muscle. For every 10 pounds that you lose, this means that you would lose anywhere from about 2 to 5 pounds of lean mass. What this translates to is that your appearance won't improve as much as you hope, because as you're losing fat, you're also losing muscle, which means that you're not necessarily going to become more toned or have the kind of rounder shape that you would hope with your arms and your shoulders and your abs, hips, and thighs, because you're losing the muscle that would give those areas shape. If you're over 50, it also means that you're putting yourself at a higher risk for low bone density or osteoporosis and potential bone fractures. To be fair, if you were to just lose weight by going on a diet without exercise, or you went on a diet and only did cardio exercise, about a quarter to a third of your weight loss would be lean mass anyway. So it's going to be similar to those methods, except you could actually lose more lean mass depending on the amount of GLP-1 that you take. There's one other important point that you should consider before you take a GLP-1 med. People do regain weight once they stop taking it. The more weight that you lose, the more that you're likely to regain. Unsurprisingly, more than a third of GLP-1 users go back to taking the medication within a year of stopping treatment. Okay, we have talked about a lot, so let's recap. GLP-1 medications increase insulin production, reduce blood sugar, and increase your fullness. As a result, you become a more disciplined version of yourself, eating less, making better food choices, snacking less, and becoming more active. There's some side effects with the medication, especially gastrointestinal issues. GLP-1s can help you lose more weight on average than diet and exercise. However, about a quarter to half of the weight is lean body weight, mostly muscle. Once you quit, you'll likely regain some weight, and many people return to the medication within 1 year of quitting. Based on what we've talked about, here is what I recommend. I am not against GLP-1 agonist medications. For people who are diabetic or obese, taking this medication is likely a much healthier route than suffering from the long-term impacts of diabetes and severe obesity. If you want to lose less than 15% of your body weight, I think diet changes and exercise should be the way to go. At least it should be the first thing that you try. Continue to tweak your diet along the way, and I think that you will see some changes in the scale. If you're looking to lose more than 15% of your body weight, a GLP-1 medication could be a good fit for you. Obviously, your doctor is the go-to source on this, not me. I'm not a medical doctor, and I probably don't even know you. If you take a GLP-1 medication, exercise during your treatment, exercise after your treatment. Exercise will enhance the weight loss that you have during treatment, and it will prevent you from gaining weight afterwards. With regards to exercise, I highly recommend that you strength train. Strength train is most critical. This will prevent you from losing much muscle mass. It may even stop you from losing any muscle mass during the treatment. It will also help you looking better as you lose weight. To maintain or build muscle, I recommend strength training anywhere from 2 to 4 times per week. Make sure you train all major muscle groups in your body at least twice per week. Finally, whether you take a GLP-1 medication or not, I have the same recommendation. You have to make diet changes, and you have to make diet changes that you can stick to for months, years, or ideally forever. Avoid making diet changes that are so large that you're just going to quit within a few weeks. When you are done with the medication, if you return to your old diet, you will return to your old weight. Permanent weight loss comes from permanent diet changes. To learn more about proven methods for becoming the healthiest and fittest version of yourself, please subscribe to my channel. I'm Dr. Preuss. Thanks for watching this video.